Hi, how are you? So we're talking about in this episode a lesson that mechanism guide in GLP-1s, GLP-1 and GLP I. So the brand is Zepbound Mounjaro for the two and GLP-1. So the mechanism of action for that is depending upon the use. So we're talking about why we're using it, what's the purpose, and the content. So I'm literally reading word for word and what it is for the mechanism of action for Tirzepatide, which is a GIP receptor and GLP-1 receptor agonist. It contains C20 fatty diacid that enables albumin binding and prolongs the half-life. Tirzepatide selectively binds to and activates both the GIP and GLP-1 receptors. This targets for native, which is natural, GIP and GLP-1. So we're talking about the physiological regulation of this. It regulates your appetite. It helps with caloric intake. Non-clinical studies have shown that it may further contribute to other food regulation, and there has been more studies in use for these medications. Both of these receptors are found in areas of the brain to involve appetite regulation and also have been secreted through the GI system. And animal studies have shown that it distributes and activates neurons in the brain to evolve regulation of food and intake. So that is the mechanism of it. And, I want to discuss that because why are we using it? So pharmacodynamics is what is it for? And Tirzepatide, which I'm talking about, is the Zepbound or Mounjaro on this one. But both are used to lower body weight, and they're helping with greater fat loss and helping with managing your lean muscle. Tirzepatide, as I had spoken with, is 2, insulin secretion in the glucose-dependent manner and reduces glucagon secretion. It increases the insulin sensitivity and lower your insulin resistance and helps with demonstrating decrease of hyperinsulinemia. And that is where, most individuals have major issues and other health issues. And it will delay gastric emptying, which does say that. And it may, over time that will diminish, but initial dosing, sometimes people feel very full and may have some initial problems. So pharmacokinetics, meaning how does it absorb, how does it distribute, how is it eliminated, and how is it metabolized? Okay, so how is it absorbed? It's absorbed subcutaneously, so usually people inject it in, I call it the old Macarena, the arms, the legs, the stomach, or the back. And so it's like, oh, Margarita, it's a silly thing, but think those kind of areas. It's concentrated within about 24 hours, and the bioavailability is about 80%. So that subcutaneous and the abdomen, thigh, or upper. Now it distributes throughout the body in a coefficient variation, which it's distributed by subcutaneously to help patients and OSA and obesity. So those with sleep apnea and obesity. And it's around 29% respectively in that change. And it does bind and through the albumin of the blood. So how is it eliminated? So apparently, through the population of tirzepatide or the semaglutide overweight patients, they approximately eliminates with a half-life of 5 to 6 days. So that's why when the injections for most patients are weekly, unless you're in a maintenance or which then you may go into a microdosing or maintenance mode, which I'll discuss in another lesson. But everything has to be done, safely with a healthcare provider and someone that is aware of where you stand and how you are. Never do this on your own without real supervision. And how does it metabolize in the body? So it metabolizes by, the peptide itself is attached to a beta oxide of C20 fatty acid and amide hydrolysis. So it is pretty much the liver, and it will go through the pathway of C20 fatty acid, and it will absorb and metabolize there. And then it's excreted through metabolites via urine. And, that's why sometimes you'll see some patients that are on this will have a higher nitrate protein ketones. So usually not ketones, but protein and nitrates. But if they drink a number of weight things, then it won't be a problem. And that's the general gist. Another slides I've discussed is, side effects and contraindications for these medications. Like no patient should ever just be on something. But, we're just talking about, the benefits of these and also is it a tool and natural ways. But right now it's just kind of what exactly does it do and how is its potential administration for an individual. So that's what that is. If you have any questions, obviously reach out. And I'm here to help in any way that I can and talk with you soon.